I'm so committed to this research is because if we can get this message out to some kid that you don't have to live your parents' choices, you can take another road, and maybe to the parents to say, there are tools that can help you be a better parent, and you don't have to parent the way that you were parented. And then to the service providers, give them the tools that they need so they can coach families who are living in the crisis of poverty. I'm Sabrina Kelley. I am part of Team Fresno. I live in Fresno, California, and I work for the Wells Fargo Foundation.
Fresno has one of the highest rate of child poverty as well as child maltreatment. So we are using this adverse childhood experiences framework to address child maltreatment in Fresno.
We are looking at these perceptions of what parents think child maltreatment is from from people of color perspective, because we often see that we might think it's normal or part of our growing up, so it's somewhat normalized or justified.
Use those listening opportunities as an opportunity to build relationships, as an opportunity to give parents to share their own stories, and then as an opportunity to kind of redefine and level set that this is not okay, that just because you survived it doesn't mean it's okay. And then presenting the information and the data about the social determinants of health, that are caused by childhood maltreatment. This problem is important to my community because if you look at communities of color, they bear a disproportionate burden of health issues like diabetes, like obesity, like behavioral health issues, and all of the data around childhood maltreatment point to child abuse as the genesis for many of these things.
So what we are learning is that there's a lot of great services happening in Fresno, but mostly those services are in silos, and we really need to help community-based organizations or even the local governments to kind of come together to think about how we can provide services in a more holistic way.
Even in social media, we see, I know in my background, there's all these memes that make fun of how we get hit and things of that nature, and I hope to see that in 5 years that the knowledge or the information catches on in terms of that these types of experiences can be very harmful.
I really want to see that paradigm shift happen between understanding that this is something that I grew up with, and if I survived it, my kids will survive it, to really understanding the health implications of childhood maltreatment.
IRL is very unique because it was a requirement to have a community leaders, and really integrating Sabrina as a part of the research team, I think that's very unique.
Research. We have a local Fresno Trauma Resiliency Network that has launched to bring service providers together to look at what everybody's doing across the board and to create some consensus and collaboration. So that's really working well for us.
But I think one thing that's unique for us is that we bring two different perspectives in terms of from a privileged perspective that Yumiko talks about, right? Growing up with money, and Sabrina and I always talk about the not privileged perspective, growing up in poverty. You don't really see people from poverty in these positions to conduct research and to really understand what the community is really thinking. So for me, in a culture of health, is that everybody have access to this information. My community would have access to the information. And when I say this information, I meant, whether it be research, whether it be anything to make a decision for our community to enhance their quality of life.
In the culture of health, all the child-serving agencies in Fresno will use public health framework to address child maltreatment, and more specifically to focus on preventive services so that we can support families before children end up experiencing maltreatment.
In a culture of health, everyone is empowered to live their best life, Everyone has the tools to live their best life and the resources and information to live their best life. And everyone works collaboratively towards the end goal of building a culture of health.
In this whole world,